this magic pill, right? Called Ozempic. I call it magic because it seems like it works wonders for a lot of people. Even though this pill was created for just treating diabetes, what can you tell me about it? Is it good for people? And do we know at this point, even though it's early on, any side effects down the road?
So Ozempic is a peptide. It's not a drug. I mean, the pharmaceutical companies obtained FDA approval, but it's a peptide. And a peptide is a small protein that your body makes. So it's the same as your hormones. Your body makes it. It's not like a drug that comes in and is made in a lab only. It's a peptide. So your body makes peptides. And when this particular peptide, which is called a glucagon-like peptide 1 agonist, what it does is it affects the way insulin and sugar interact in your body. So it got FDA approval initially for diabetes. And it's amazing. It's wonderful. Then it got FDA approval for obesity, which I think is great too, if done properly under the supervision of someone who actually knows what they're talking about, because it's obesity that's killing all of America. So you don't have to get to diabetes. I mean, once you're obese, you're doomed. So you have to change your diet, change everything. But you know what? If you can have some help, the peptide can help. So Ozempic is great. And then it also got FDA approval for cardiovascular support. So it's a great peptide. But this is the problem. The problem is, like everything else, because we're Americans and we think in terms of a cure-all and a pill to save, to take care of everything, because we don't want to do any of the work. We basically we're abusing Ozempic, Mounjaro, all of these peptides that have FDA approval. And the reason we abuse them is because we think now, okay, now I can be as skinny as I want to be and I can eat whatever I want to and drink whatever I want to. Well, but that's not the way it works, unfortunately. Unfortunately, if you drink alcohol with Ozempic and Mounjaro and any of these peptides, you actually endanger your liver even more and you get pancreatitis, you get a lot of problems. So anyway, so Ozempic, as far as I'm concerned, we use it in the practice. We used it before it was FDA approved because we've been working with peptides for almost a decade. And we know how to do it, but we do it because in a way that we follow our patients, we talk to them pretty much every week, every other week. We also make sure that their hormones are in balance. We also make sure that their diet is the right diet. They exercise, the sleep, the stress management. We put the things together for them and we kind of quarterback their health. So in our practice, we've never had a patient who had any significant side effects. But in the people that go and buy it from, local whatever pharmacy on a prescription written by an AI, I have to tell you, I would not be so keen on doing it because I would worry about side effects that I know could happen if everything else is not put in place.
Yeah, I feel like a lot of people would do anything but exercise and eat well. It's just like anything you would and as you said, you need to put the work and you need to just do it. But what since you mentioned about the insulin and sugar levels and how it was initially approved by the FDA for diabetes, how does this peptide help people lose weight? What happens inside an obese person body that helps that person to get in a healthier weight?
Well, this particular peptide, which I said it's called glucagon-like peptide, um, what it does is it helps your body process sugar differently. It releases insulin differently, and it works on your brain essentially. It also works on habits. Like if you bite your nails, this will help you not bite your nails. So it's a very complex, beautiful way in which the glucagon like GLP-1 agonists work. Um, I think that, it slows down digestion and it slows down the way things come out of your stomach. Food gets digested. So that's where a side effect can occur because it can kind of stop. It's called gastric paresis, which means stops your stomach from emptying out. But that's why you have to know what you're doing. Um, so that's one of the ways, but it's a lot more complex and it affects a lot more than just the gastric emptying. And it cuts your appetite, so you're not hungry anymore. It does a lot of really beautiful things, but it also gives you nausea. It also makes you sick if you're not doing it right.
That's one of my issues with this peptide, right? When people can get it anywhere online without a a doctor who cares like yourself, then it's not really, those people are not really changing any kind of behavior. So sure, you will eat less, but you will still eat the same crappy food and not exercise. So, and everything has a cost. As you said, you can have nauseous and you cannot feel well because you still have your same diet, hoping that you can keep your lifestyle and just adding this peptide to your lifestyle,
Right.
you can just, change. And we clearly know that's not the case, and people should be more aware before even diving into that. But my understanding is like it helps more for people who are very obese, and it has very little effect from people who might be, I don't know, like 10 pounds heavier or 15 pounds heavier. It's like it works more with extreme cases. Is that correct?
Yeah, the data says that, but I find it in my practice that if somebody wants to lose 10 pounds and their hormones are imbalanced and they're following our diet, exercise, lifestyle support programs, I will give it to them for a couple of weeks. There are people who'll do it like, they'll have to go to an event. It's a great, you know what it is? It's a great tool in our toolbox. But the thing is, you don't need to use all the tools in your toolbox all the time.
What's up, everyone? If you enjoyed that, then press here to watch the full unedited episode. And don't forget to subscribe. I'll see you next time.